How do we take a tooth like this and turn it into something like this? Hi there, my name is Dr. Richard Anderson. I am the dentist at the ēSSENTIAL Dentist. This patient had a problem with his upper tooth. He didn't like how it looked, but it was also causing him pain. So I used this special type of x-ray called a cone beam computed tomography, or a CBCT, to find out what was going on with his jaw. We found that he also had an exposed root surface, or a broken off tooth down at the bottom. So we used this technology to diagnose and discover the problems that he had. We discovered that the decay on the upper tooth actually had gone into the center part of the tooth where the nerve is at. And this causes a lot of pain. So we were able to get the patient out of pain, repair his tooth, and fix everything, and take out the tooth on the bottom and prepare it for an implant in the future. This technology is wonderful. It allows us to see three-dimensionally around the patient's skull. I then did the patient's root canal. After we made the initial diagnosis, did the root canal, and then used this special piece of technology called the Cerec machine to scan his upper jaw, his lower jaw, and the tooth in particular, and then how the teeth fit together to make a crown that could be completed within 1 hour from the start of the fabrication. So we use this technology to make the crown. It is really a great way of doing dentistry. No temporaries, no waiting. You'll be completely done before you leave the office. This is a lot of stuff to do in one visit, but we were able to complete it in one visit. It took us around 2.5 hours. The root canal, the build-up, and the crown all included in this time frame. So I used this brilliant piece of software to actually draw the margin of the tooth, to actually design how it fits, to design it to look like the other teeth nearby, also design the anatomy on the top and shape around the tooth so it matches perfectly within the quadrant. So when you see it from the side or the front, it looks like a natural tooth. Now with this particular tooth, the material that I chose originally is really beautiful, but it was a little bit wider than what I wanted it like. So what I actually did is I took the tooth out. I did what's called a custom stain and glaze, which I made the tooth look exactly like the tooth next door. So what we do normally is we mill the crown while the patient is waiting. Then I do the custom stain if necessary. So when I delivered this crown the first time, I saw that it was too white. So I actually went in, matched the color exactly by painting a stain and glaze on there, and then putting it in the oven, and then firing it to look exactly like the other tooth. Then we took the tooth, upon the patient's approval of its shade, match, shape, and everything else, and we put it in the patient's mouth for a try-in. After the try-in, then we cemented it on using a special type of cement that gave us the appropriate color transmission from the inside part of the root to the outside part of the tooth. The patient loved the restoration, and you can see the final result. It looks fantastic.